So the first thing is I'm gonna do is oral and the ointment, and then I would check the vitals and the lab values and check for a finger prick, and the vitals and the lab values were good, and then my patient didn't have any insulin, so we don't have to check that. And then the next thing is I'm going to look at the prescription orders. So this is from Dr. Awesome. So Dr. Awesome ordered acetaminophen suspension of 240 mgs every 6 hours PRN for fever by mouth, and the neomycin 0.5 percent ointment to effective late PRN. And then it was Jason jar. Okay, and then let's go wash my hands. So I'm just gonna go wash my hands. Okay, and then I'm just gonna turn on the water, put my hands, and then I'm going to wash my hands. Just gonna lather it up. Okay, and then I'm just going to rinse it, and then I'm just going to come over here, dry my hands. And then I'm just going to take a clean paper towel, turn it off, and then we're going to next we're going to do my 6 rights. So we're just going to do the 6 rights. So I'm just going to look on the MAR, and then I'm just going to match up the medication that I'm going to be giving. So I'm going to give acetaminophen 240 mgs every 6 hours for fever by ml 2.5 ml. The date says it's going to start 9/9/20 at 9 o'clock, and I'm going to make sure I have every person, which is Jason Jar, and she's a female, and so that one, and then the neomycin. So I'm just gonna match with the neomycin is 0.5 ointment. That's for the effective late. It starts at 9/9/20 at 9 o'clock, and it's Jason, and it's Jar Jason, so everything looks good. And then I'm just going to draw up the suspension. I'm just going to shake it before I give it. And then I would just write on it to know what medication I'll be giving. And then I'm going to do it on both of the medications. And then I'm just going to check the MAR and the prescriber. So both of them I'm going to be checking, so make sure that they match up. So that's my second check. So it's the acetaminophen 240 every 6 hours in fever, and then it's the acetaminophen suspension 240 mg every 6 hours PRN fever by mouth. Everything matches up. And then it's the neomycin 0.5 ointment to effective lay PRN, and then neomycin 0.5 ointment to effective lay PRN. So that's my second check. So everything is good, and then make sure it's the same. So it's Jason Jar. It's the right person, right dose, right medication, indication. It all has all the rights. So that's good. And right date, 9/24. Oh, the date? Yep, 9/24/20. So 9 o'clock. All right, everything looks good. So that is good. And then I'm going to knock on the door. Hi, my name is Yolanda. I am from Lake Regional State College. I'm gonna give you some medication today. So can I get your name and date of birth? I'm just gonna look at a wristband and I'm gonna check with the MAR to make sure that it matches up, which it does. So I have Jason Jar. So everything is good. And then I'm going to, before I administer, that's my third check, is I'm going to make sure that the medication matches up. So it's a acetaminophen, 240 mgs every 6 hours for fever by mouth. The date was 9/24/20 at 9 o'clock. And it's the right person. And it was for a fever. That's good. And then the neomycin. The neomycin is a 0.5 ointment for affected leg, PRN. At the start date is 9/20. The start date was 9/24 at 9 o'clock. It's Jason Jars, and everything matches up with the MAR. And then I'm going to just kind of go right here. And then I'm just going to explain to her what she's going to be giving. So this is acetaminophen. It's for your pain today. The doctor ordered this to help you. So could you give this to yourself, or do you need me to assist you? Okay, you can give it to yourself. All right. All right, she gave it to herself. So she's good. And then the next one is after I administer her that, and then I would just assess her. After 30 minutes, I give her medication for the desired effect and the adverse effect. And if the adverse effect, I would just report that to the doctors. And then if her pain was resolved, I would just document that. And then I'm just going to move on to the leg. So the leg, I'm just going to go down to the affected area. So I would have gloves, obviously, with the affected area, but I don't have the gloves right now, so it'd be with gloves. And then so this is the affected area right here. So I'm just going to take off the bandage. So bandage off. And then I'm going to clean it off, and then I'm going to assess the area to make sure there's no drainage or anything like that. So I'll just assess the area. And then I'm going to apply some neomycin again with a Q-tip, or you can use a tongue blade, what you prefer. So I'm going to do that. And I did do the third safety check in the beginning with the neomycin. So if I did have it again, I would with the neomycin, I would just do it with the MAR too. I did do that. I did the oral and the neomycin at the same time. So that was the third check too. So I would just match it up with the neomycin 0.5 ointment affected area. Leg PRN, and so that was my third rate check too for that one. And then I would just apply this on the affected area, and then I would put the bandage on like this, and then I would date an initial and the time that I put it on. And then after that, I just want to lower the bed to the lowest position. I want to hand her call light. So here's your call light. And then I would put the bed railing up to make sure the bed railing was up. And then I would allow her to know that I would be back within 10 to 30 minutes because I need to recess her. And then And then I would ask if she needed anything else. And then after that, I'm just going to, I would just go wash my hands, which I'm going to go do. But I just want to do the MAR. So I just want to document. So I just gave her on the MAR um, um, that I gave it to her. So I'm going to just do the hour I gave it to her, and then the date I gave it on. So I would just do that on the MAR. And then I'm just going to come over here, and I'm just going to go wash my hands again. So I'm just going to wash my hands for my ending step. So I'm just going to wash my hands one more time. Alright. And then I'm just going to that. And then I'm just going to come over here and dry my hands off. Off, and then with a clean towel cloth, I'm just going to do that. And then I would be done with my hand washing for my ointment and my oil. So the next step is I'm going to do is my my ears and my eye drops. So with my ears and my eye